Okay, so knock knock, hand hygiene. Hi Casey, my name is Sarah. I'll be the nurse taking care of you today. Can you state your name and your date of birth for me, please? And we have Casey Banks, 10/2/1965. Casey Banks, 10/2/1965. Do you have any allergies, Casey? And Casey says that he's allergic to aspirin, and I do see an aspirin allergy here. All right, Casey, so the reason why I am here is because we have an order for your albuterol inhaler. I know that you're having a bit of shortness of breath right now, is that correct? And he says, yes, it feels like my asthma is acting up. All right, Casey. So we do have that albuterol. It's gonna help open up your airways and relieve that bronchospasm that you're having. I'm just gonna do a couple of assessments so we know if the medication works, okay? So first, I'm just gonna do a pulse oximetry reading here. So I'm gonna select a finger that's warm, has good capillary refill, there's no artificial nails on, and there's no swelling. I'm gonna clean off your fingernail here. And while I'm doing that, do you have any pain on a scale of 0 to 10? 0 being no pain, 10 being the worst pain. And Casey says, nope, there is no pain, it's a 0 right now. So I'm gonna put the pulse ox on. I'm just gonna leave this on for the therapy, okay? Yep, so your pulse ox, I'll just confirm that with your pulse here for 15 to 30 seconds. And your reading is about 92%. We're also looking at the heart rate too, because the albuterol can cause tachycardia or an elevated heart rate. So your pulse is about 85 right now, so that's totally normal. We're gonna keep an eye on that, and I'm gonna sit you up so I can take a listen to your heart and lung sounds. We're gonna have the patient sit up at about 65 degrees for the head of the bed. And to finish our pre-assessments here, we're looking at the respiratory rate and rhythm. Casey's respiratory rate is about 20 right now, so it is elevated. It looks like he is working a little bit hard to breathe, so I'm just taking a listen to your lungs. All right, so there is some wheezing going on. So yep, just a little bit higher here. We're watching that pulse ox during this time. So before we do your medication, I'm just gonna do our mark check and get that all set up and ready to go. So we have Casey Banks, 10/2/1965, allergy to aspirin. We are giving the albuterol Proventil. And I have albuterol Proventil inhalation. This is an inhalation, 90 micrograms. I have 90 micrograms every 8 hours, dose of 2 inhalations. This is a new cartridge with 200 doses, so I should have enough. At 0600, it was not given for the 0600 due time. This does not contain aspirin and it's not expired. So I'm going to insert that back into the inhaler device right there. So mark check 3 is complete. We've done our pre-assessments. So I'm going to remove the mouthpiece and place this into our inhaler here. So you want to be shaking the canister about 5 to 6 times just to loosen up any powder and other ingredients here so that they get the correct accurate dose. If we don't shake, that would be considered a medication error. Okay, so just making sure it's really shaken up. If you shake more than 5 to 6 times, that's okay. All right, so Casey, what I'm gonna have you do is I'm gonna have you take a deep breath in and then out. When you take a deep breath out, you're going to place your lips around the mouthpiece and then you're going to inhale while I press down on the canister, okay? So in, out, place your mouth tightly around the mouthpiece here, close your lips around there, and we're going to press down and you're going to inhale there. Okay, and he inhales, he's gonna hold it for 5 to 10 seconds. And then we're gonna exhale through pursed lips. So Casey, this was a spacer. This is just helping the particles go down your airway a bit better too. So we'll do the second puff a little bit differently because I know that this spacer is a bit difficult to carry around with you, like in your purse and everything. So I am gonna show you another way. So I'm just shaking again. We're waiting 1 to 5 minutes between the first puff and the second puff. So shaking that back up again. So Casey, if you don't have your spacer with you, another method you can do is to have about 1 to 2 inches of space, so about 1 to 2 fingers away from your mouth. You can inhale, exhale, hold the inhaler that distance, And with your mouth wide open, you'll press that down, and that would create the same effect. So it's up to you which way you want to do it home. If you don't have a spacer, you are able to use it this way. So I'm removing that cap again. Casey, can you inhale, exhale, and then we're going about 2 finger spaces away from his mouth. We're going to press down and inhale deeply. And you can close your mouth, hold your breath for 5 to 10 seconds. And then once that's done, you can exhale through pursed lips. So we're going to replace the cap. And then we're also going to offer Casey to rinse their mouth. That's especially important if they have a steroid inhaler, so that they don't get thrush. That can be very painful for the patient. So you're just going to rinse. And then you can spit into here. All right, that's done. Doing our hand hygiene again. We're just going to recheck your pulse ox here. It does look good. You're about 96% now. Your heart rate is still in the 80s. Respiratory rate is a bit better, excuse me. The respiratory rate is about 18. I'm just going to listen to your heart and lungs again. So we're listening. Okay, and there are less wheezes, so that is a good sign. So, Casey, you'll want to rinse out your mouthpiece device weekly. You can use warm soapy water and let it air dry. You can also use a vinegar solution to clean it, or follow the manufacturer's instructions with that. You should have a diary at home as well, just to keep track of how many inhalations you're taking and how many doses you have left. So some inhalers will have a dose marker on here. Each time it'll go down in number. Not all of them have that, so it's a good idea to keep track so that you don't run out and would need an inhaler in emergency, and then you don't have enough puffs to take. Let's see, so we reassessed our lung sounds. I'm going to document that we did our medication here. So we'll just put 0600, SB, sign down here. All right, Casey, I'm going to come back in about 15 to 30 minutes just to reassess again and make sure that your respiratory symptoms continue to improve. Do you have any questions for me right now? And Casey says nope. Casey feels pretty good. All right, so we will come back in about 15 to 30 minutes. Bed is locked, call light is within reach, and in the lowest position.